السلام عليكم ورحمة الله وبركاته. كيف حالكم؟ How are you, everyone? Uh, عليكم السلام ورحمة الله وبركاته. I want to start as soon as possible. I think we need to make this in English because a lot of colleagues may join our this session, and it will be important to be in English because I received a lot of calls the last days after the results of 2B examination. It was like a disaster. Our heart with all colleagues who didn't make it, and we hope they will take the opportunity to the coming and next times. I hope you can hear my voice very well. Uh, I want to just to confirm that the voice will be good for the recording. Anyone can yeah, just tell us if you can hear it very well, the voice, or I need to make something before going on through it. Okay, thank you very much for sharing your yeah. So the results was not the routine results, but in fact I can understand that because this is a new system. In any new system that you may face some errors that will affect the process. So we are here to understand what is going on. Okay, so we'll try, and will be, maybe it's not official, it's not but we from the experience of our colleagues that um, we get from them during their examination experience, the impact of the long time of short reporting, the impact of the intensity of the cases, and so on. Okay, so this is very important to recognize, because October, in fact, October exam, I will make it the first one, because June it was a pilot. It was a very small number, so there is no real ground that we can build on it. October exam is a large number of colleagues, so we received a lot of maybe sometimes conflicting opinions, and we also received a lot of important good feedbacks and negative feedbacks. So we are not sure what is going on um, uh, on the background of the college. Some understandable measurements not clear. I think with the time they are going to make it more clear, and we are trying to help all colleagues because in understanding the system is very important to pass. This is very important and essential. Uh, from our side, as we are helping our colleagues to pass the exam as we can. We know that that there is some maybe lack in the information, or there is, if the resources are there, it's not exposed very well for all colleagues to review them. When the system is established, then you are going to take the advices from anyone. All advices are distributed everywhere, so it's established. For the new system, it's not still. Okay, so I discovered for myself that a lot of colleagues are not understanding the passing score, the essential criteria after they joined the exam and the exam finished, and when the results come to, they didn't know, or they didn't remember the scoring system and how they fix. So this is will affect your performance for sure. There is no doubt in this one. So I don't want to go through a lot of things during my introduction. I will go through this PowerPoint would allow us to make it structured and to be the point to the point. This is first an important issue. The change happened. Okay, from my side, I believe this will not be changed. If there is an error, even they are not going to change this immediately. This will take time. If there is any error, I think they established the change, and the change is, from my opinion, is good as a total. Maybe there is some negative areas, but as a total is a good change. Okay, and it will be with the time in the favor of making a good radiologist after the exam ends. So for any changes will have some challenges and difficulties, and some will be the sacrifice for this one. They will be in the the victims of this new change. So for our mission today is to avoid to be the victim. Okay, so by understanding more the system, understanding more what is going on, understanding how to prepare again, and taking the advices seriously, because one of the major defect happened in most of colleagues. They didn't follow a structured advices. And I will tell you some stories during our session. Okay, so let's start our. We are going to evaluate these changes through this one. So October 25 was the first real test of the new system. So as you know, the change happened on the short component and short and long. Now the short and longs are in the first day, and they are two separate components, and the oral component start to be one total component, and this is a huge change, in fact, and I will let you know what is the impact of that. Okay, so we are going to share the colleagues' experience in the exam days, especially the first day. There is a major change in the first day, in fact, and I will let you know how this will affect your performance inside the exam room. And this is how this affect the disaster of short reporting in this exam. Okay, and in fact, from the start, I'm expecting this to happen, and I will let you know why when we come to the short one. So how will this affect our plan? This is an important question we need to for colleagues who are joining January and March. They have the good chance to make the good lessons from this October exam and start to make the good preparation. Okay, so I'm going now to go through this. So the first day, the reporting day, for my opinion, the major change is the long time of reporting. Yeah, it's more than 3 hours you are sitting on the table, on the desk. You are writing for 3.5 hours, maybe approximately. You have long time for report. You need to be focused, stressed all this time. One of the major, you can circle this one. The major thing I heard from all colleagues, they are feeling boring to practice short and long through the preparation and inside the exam room. They got exhausted, and so this will affect your performance. But when you start 1 hour of report writing, and you are not prepared for that, what will happen? You will start to make your the things more short. You may lose the concentration and then start to miss some findings. And I will come to missing some findings and key findings to the scoring system. Okay, this is what affect the scores. Okay, so you need your performance to be along the 2, the 3, and and 15 minutes, 3 hours and 15 minutes to be concentrated all the time without any loss of concentration. Because if you make a safety problem in one case, this will affect your case totally, all the case. So if you miss the major finding in a case, you will lose it most of the time. It's obvious now. So this is affecting your practice. This is affecting your preparation for the exam. If you are not practicing short and long intensively by typing, by thinking, in the same timing, in the same settings, you will face a problem inside the exam room. This is a reality now. So this very important. You know, we are in our routine work, daily work, we have maybe a very big list of cases. We are doing this, but we are not under this tension all the time. You can go and take some coffee and come back, and you may take your phone and make a call, quick one, two. You may go up and come down. You may discuss one case with your colleague in between the during your work, the daily work. To set 3.5 hours, it's a huge change, in fact, in my opinion. And this is a challenge, need to be motivated. So this, with the changes in the scoring system of short and long, make a very big change in the scores that the people are getting. So this is very important to understand. So we are going to the oral exam. Regarding the oral exam, I think there is no change in the structure. There's 2 rooms as we can, but there is change in the type, the cases. The cases now is in 3 cases in each 15-minute block, and the cases start to be bulky. What is the meaning of bulky? That I mean that anti-mini cases, like a simple X-ray of upper lobe collapse without CT scan, or without maybe more complex scenario, it will be not the routine one. Before, it was one of the good Viva cases that will be presented. Yeah, you'll have the upper lobe collapse, which is subtle maybe, and you need to go. Most of the time, you'll have a CT scan after it. We heard that some areas start to be in the setting like head and neck, and this is in the curriculum. Head and neck is still part of the curriculum, but you may found or hear a noise from one day that they have 2 cases, or a subtle case, or one hard case. So this will not change the behavior of the exam, as they told that level and type of and content of the exam is still remain the same. There is no change in this one. But you know, the exam, even they are making the 12 cases, you'll found the very big change in the results. One scoring one day, the bus score is 275. And one day the passing score is more than 300. So there is a major change between the days, because you know each day you'll have a separate packet along the Viva days. So this is very important to understand, that the exam is testing your performance in the radiology, in the general radiology and emergency radiology. So you need to be aware about all the topics that can come, and you need to be aware about the scenarios that can come in each modality and each case. This is need a comprehensive preparation for the exam. Some old resources of the exam may give you a false preparation pathway for what case can come in Viva. So this is very important to know. The cases start to be more bulky. They are expecting you to discuss more, to talk more, because you know it's more complex now. You are evaluated in, and you'll be evaluated in knowledge. You are in picking the findings, how fast you pick the findings, how accurate you describe your finding. This is very important, really. Yeah, you need to be more structured, more focused. more concentrated. You must take the control of the inside the exam room. Okay, they are disrupting you when or interrupting you when you are not on the good pathway. This is a fact. When you are on a good pathway, no one is going to interrupt you. No one, even if he tried, you are going by your good approach and good describing and taking the case with good and telling everything. So no one is going to interrupt you. Okay, so when you are taking the case away, they are going to interrupt you. Okay, because this is an experience from being an examiner for a long time, examining a lot of colleagues. When you found that the candidate away from the procedure, you may feel that the colleague is not familiar with this study, so start push him toward the answer, and this is all the time affecting him badly. Okay, so also I want to discuss with you the passing score, because I found that a very big defect in understanding this, even after the exam results. Okay, I received a lot of call. The people are not understanding what is going on. To pass the exam, the only way without any problems to pass the three components, and this is like the importance of the balance in studying and preparing for the exam. Okay, because a lot of scenarios. Passing Viva very good, getting very good mark in longs, because longs even they change the score of the reporting, but the longs stable component. There is no major change in the background of the exam, even Viva. And Viva, there is a lot of resources and people are afraid from Viva, so we are doing Viva a lot. But all the the rapid problem solved and rapid reporting problem solved. There is no normal and abnormal. All cases are abnormal, so we are going to finish this very easily, very nicely. So don't worry about shorts. And there is a trap, because short examination in June was simple, so all the it was a fake reports that the shorts will be very good. I know that short will be more complex with the time. Okay, because with the time the cases that with complexity will take time from the cases which is straightforward, and with the challenge is in the duration of the exam, the timing, 2 hours and then 1 hour and 15 minutes or 75 minutes. So this is, and you are starting the exam with short now. Before you are starting with longs, and then you are going to rapid. Now you start with short, the more exhausting component, and this affect also longs for people who is doing long very well before. So passing the three component is the safe way, and there is no way for that without balanced preparation. And in fact, the preparation for long, short, and Viva on the background of studying and reviewing and seeing the cases may be totally the same, but the difference in the input and output outcomes. Okay, so fail 2 or more, this is unfortunately failed. Pass 2 and fail 1, wait and see. Wait and see, you are going to wait the system of SEM, standard error of measurement, and this one for short and long, it will be, will be difference in every setting. So marks that will be added to the people who are under the standard with this. For example, the standard bus mark for short this time was 64 after they removed the 6 cases. So it was for 64, the passing mark, the standard pass mark. Anyone getting and they add 5 marks as standard error of measurement. If you passed Viva and long and you are within the 5 marks, under 64 in short, which is a standard pass mark, you are going to pass the short reporting and you are going to pass the exam. Under this one, with 1 mark, you are going to fail all the exam. So there's a lot of sad stories. In fact, I'm so sorry. I'm so sorry for them, but this is the life. This is the FRCR to be exam. Okay, 1 mark before it's half a mark, and you are going to repeat all this journey with this one. So we are not going to discuss the past. We need to take the lesson for the future and make and build on it. Okay, so it's understanding this scoring system will give you one lesson, one important one. Please, all components have the same priority. All the components have the same way and balanced preparation. You must save time for short, save time for long, save time for Viva. Here, I mean the practice, not reading books, not reviewing the case and telling, yeah, this is upper lobe collapse. Yeah, this is dilated esophagus. No, this is very bad and very fake one. Okay, it will not lead to the success in the exam room. Okay, this is true, and you need to like this one, because once you told all the time you are telling all colleagues, please practice, and they are leaving it. I'll let you have example. I make some survey by asking some colleagues who take the RADME brackets for longs and short after the exam finished. Okay, how many exams you solved, even you opened? Okay, I found a very bad survey. Okay, most of colleagues, they are not opening most of the exams, they are not finishing them. So why you book them? Simple question. Okay, so you are booking the things to practice, to see the ideas, to practice. You are making a very hard work to make the simulating software, because software is very noisy and wasting your time inside the exam room. So you are not using this, you are not familiar with it, and you need to pass the exam. It will be very tough, very tough. Please, this advice is very important. Here, I want to share this one, the long cases reporting scoring and the short case reporting scoring system. Each case in longs and short are marked from 5 marks. 5 marks. So in long, you have 6 cases, so the 30 marks. And very important issue here that will make you also understand why they have this way of evaluation. This is very good and fair. I think the most important thing in this news changes is the fair pathway of marking and making this between 2 separate examiners all the time. And this, if there is difference, they must flag it and discuss it together to reach a final decision. So here 2 examiners will mark, and average between them will be taken for your answer. If there is the framework difference in short, in long reporting is 1 mark between the 2 examiners. If one examiner is giving you 3 in case and the other one is giving you 5, they must sit and choose which mark they are going to give to you, because this is a big difference between the 3 and 5. Okay, so this is very important. Here is a very important one. All questions include question-specific marking guidance from the college, okay, to indicate key findings. Please, someone is telling me I missed the main finding and they didn't give me anything. They give me 0.5 in the case. I told them what you are expecting. You're expecting to, before, maybe if you are writing anything in any part of the exam, you are taking some marks. They change this. Okay, key findings is the main issue in your life and career. If you miss the main finding, so what you are doing in the exam? So key findings. Missing the key findings is a disaster. Don't make it. Okay, so missing the diagnosis, the principal diagnosis before, when you are putting the differential diagnosis in the diagnosis in the differential diagnosis and section, and it will pass. Some nowadays we are hearing some things that may affect this scenario. Okay, so and recommended onward management is written also in the specific marking guidance by the college. So they are not making it from their heads. There is a guidance marking scheme. They are following it, and this is make it of sense. Okay, the same apply in the short. Okay, but the difference in also, if there is one mark between the examiners they are going to flag it, and all questions are having the key finding, diagnose, and recommend onward management. Do you realize something, that the short is very near from the long in the scoring, in everything, and with time half of the short exam will be near the long reporting in description, but in writing. But I want to realize something. When you go to the sample provided by the college on the website of the Royal College, you will find that the very good answer is the specific, to the point, accurate one. The average answer is a long one, including all the described in the good one, but with a lot of words in a more statements. Okay, but this is noisy. Try to be specific, to the point. I will make samples by the end of this session to allow you understanding the thinking, how to write something. Okay, it's very specific, to the point, giving the relevant negative, very good specific one, and giving the positive must be mentioned. There is no way. You need to catch the key finding, and telling what you are searching specifically for this disease here on this film. Okay, and what is your management specifically for this film and for this patient, even with the clinical data provided. So this is very important. If you are making it mix, everything is disordered everywhere, everything anywhere, it will affect the overall performance in the exam. And I want to know that something. I got confusing feedback. A lot of colleagues are telling that I did very well in short. I write a lot. All the cases, I know them. They are shocked, really, and I'm sorry for their loss and their this is as I told, very bad impact on yourself when you got some experience like this one. When you are losing marks in every case, you are losing mark here and 2 marks here, 1 mark here, 2 marks here, and so on the all cases. And with concentration, losing the concentration inside the exam room and exhaustion, you are going to lose concentration. You may miss a fracture here, you may miss something here, you may miss a pleural effusion here. So with this all misses, you are getting bad marks or average to borderline marks in each case. So with the 25 cases, you are going to lose a lot of marks. You'll find yourself with leakage. You are going to so how to make this, or how to manage, we are going to discuss this now. Okay, in the oral exam, every examiner is marking the sheet of the 6 cases as we will discuss, and the 3 cases who is going to examine you, and the other cases by the other examiner who are going to observe the process. So 2 scores in each case, 2 scores. Okay, so each case is going to get a 32 mark. We'll discuss this on the table. Maybe when we have the table, I will let you know how this. The most important issue here is the passing score. As I told you, there is a huge difference depending on the day and the angle of standard setting methodology they are using. So it may be, but the average one is 280 marks. From 480 marks. Okay, so this is very important. Also, there is a framework between the examiners in each case 5 marks, and if there is more than the 5 marks, they are going to set and flag and review this in discussion. Okay, let's go to the domain. Here is very important in the change of the oral examination, because also a lot of colleagues got a problem with the Viva examination and they got bad scores. When you discuss with them, you'll find a lot of issues, despite the preparation and despite the advices, despite when you are inside the exam setting, the stress is have a very bad effect. And I hope everyone to try to get this anxiety, trying to figure this out, because this may affect your performance badly inside the exam room. Okay, so observation is the important issue. The findings, missing the findings, believe me, missing the findings is the big issue in the exam, in the all components of the exam. Missing the findings is the bad issue. So how to solve this one? Review a lot, see a lot. You must see the cases in all modality. The topic, if we have a topic like a vascular necrosis or Behçet's disease, you need to see it in X-rays. You need to see it in MRI. You need to see it in CT scan, in early presentation, in late presentation, with complication, in bilateral setting, in unilateral, all the findings, if it's Behçet's or a vascular necrosis, with sickle cell disease, you need to see it in all scenarios. Why? When you are going to take it in all scenarios, you'll get the maturity of the case. Okay, so when the case presented to you in any setting, in any situation, they are going. I got a conversation today with one of our colleagues. The examiner is bringing the case in the axial, and he insists that the candidate must get the finding from the axial. There is the college is not putting the coronal or sagittal. It's not there. Only axial. You need to get the findings from axial, and the colleague is insisted to get coronal or sagittal to get the diagnosis. So this resistance will affect even the communication score, affect your clinical and the belief of the colleague of the examiner that you are you can pick it and do it very well. So it's very important to understand this one. As you know, radiology knowledge and observation, clinical reasoning, clinical safety, and the management. If you are not hitting these domains during your performing and when you are performing the case, if your idea all the time about the diagnosis, what is the diagnosis? Diagnosis is very important component in your final approach and final when you perform the case. This is the end result. But how you go through this, how you show yourself to the examiner, you have a good knowledge or not, you have the good observation. Oh, sorry, just a second, my battery is going to, sorry, forgot it. Sorry for that. Okay. So back, these domains are going to be the scoring system will be through each one. In each case, you are going to be marked for each component in each case. So, and all the cases will have a domain of between fail and excellent, fail, borderline, fail, just pass, clear pass, excellent. And when you have the final markings, the final marks will be the sum of the two examiners in the one case. That's why I'm telling you it will be just a second to bring the it will. If you get we take this example, if the first case you got excellent in the knowledge, you make the positive domain characteristics, you described all the finding, you mentioned all the important information. In Behçet's disease, for example, we take this as an example, you told this is or in a vascular, you discussed the vascular necrosis process, you discussed the importance of checking the other side because it's bilateral in maybe 20%, and you are discussing the vascular necrosis. Maybe if it's not Behçet's disease, it can be due to other causes like sickle cell disease, like if the patient is having corticosteroid. So you told all the knowledge that associated with the disease. So you got excellent. So you got 4 marks. You will get it from here. Fail will take 0, 1, 2, 3, 4. So it's 4. In observation, you picked the finding, but you missed something in the CT scan, in the periphery of the film. Maybe you missed incidental finding or something. So you're getting to get 3. In clinical reasoning, you are not connecting this with the sickle cell disease, and the patient may have subtle. So you are going to take 2. This is not real example, so we are just trying to figure it out. And in clinical safety, you are not recommending measure the right measurements. You make the borderline fail, no predominance of positive or negative domain. It's borderline. You are borderline. You are displaying some negatives and some positive. So you are getting to get 1. And in fail, you are getting 0. We found some colleagues is getting 0, 0, 0, 0, 0 in all components. Why they make this? Maybe he totally missed the case. Maybe he unsafe in this case, because if you are going to potentially harm the patient, you may take 0 in all components. So it's very important to understand this one. So getting this, you are getting here 10 marks from 16 in this exam with this examiner, and the other one, suppose, is giving you 8 from 16. So you, in the case from 32, you got 80 mark. 18 mark. Okay, 18 mark. So you got the idea. So you are also leaking a lot of marks, is going down from your score, and then you'll find yourself. And here is a catastrophic issue here. The communication is, no one is understanding this one. I mean, from our colleagues, it's very important. Okay, I'm not going to make someone, I'm pushing him all the time, pushing him. His voice is very low, and he is not active, taking the case very actively. He's talking very fast. I can't understand him. There is a language barrier between even the native speaking. Okay, there's some barrier. If your voice is very low, your communication is not good, there is a very huge mark. You are going to get 96 mark from 480 for communication only. So we got colleagues who got 48 in one room and 12 in one room. I have a story of 36 in one room, 0 in one room. I have a story of getting 36 in one room and 12 in one room. Very big difference. What happened? Okay, maybe you lose concentration. You are not prepared for 1 hour story. You are not ready. You are so stressed. You need to fix these issues before going to the exam room. Okay, because if you are so stressed and you can't control yourself, this is a major defect. You need to fix this one. And this exam is an exam of skills. They are preparing us to be a confident, qualified radiologist. This is the aim. You are not afraid to be in a committee with pioneers discussing cases with them in multidisciplinary team. This is the main goal. Okay, so you are active in the team in the hospital. You are managing the patient actively. You are having, this is very important skill as a doctor. Okay, so this is essential. Because I heard some colleagues that they are talking about that communication, why they bought this communication fact. This is mandatory skill, okay, in your performance. Okay, which as the radiologist nowadays must be aware about the technology, must be aware about the AI. If you are not being actively engaged with this one, you must be communicating actively with the environment and the community inside the hospital. Okay, this is very important for your. So this exam is evaluating you as a standard radiologist to be in the new era of radiology. Okay, since 20 years and going on in the future. Okay, so the message: start early as you can, preparing yourself for this exam. There is no time to waste. Okay, if you are joining January exam, you're already in shortage of time. You need to start as soon as possible. You need to practice all the components. You need to start. We hope that this is fair and more accurate in the evaluation. This will prevent maybe the previous really previously it was more unfair, very unfair. Okay, because you may expose to one examiner who is asking in deeply in subspecialty. Okay, and you may be not tested in the viva all the viva in 2 or 3 modules. Okay, so here now everything is equal. The colleagues are in the same day, have the equal evaluation. If the cases are straightforward and they are doing well, the score is going to be, the passing score is going to be high. If they are having tough cases, and can happen, okay, the score is going to be low, and so on. So this is, I think it's more fair, and this will appear in the future. Okay, but I think it's more fair than before. Okay, so this is overall is good. Okay, but all new system need time to be mature, and change always there. Yeah, the chance is always there to adapt. That's why we are making this session. Is don't resist the change. The resistance for the change is bad. Just understand what is going on and adapt yourself. This is a very important message. Adapt yourself to the change. What are the new criteria? I'm going to follow the new criteria. That's it. Don't waste your time. Make following the previous. The previous is a story, and now is a new story. So follow the new story. Okay, just take what can be applicable here and do it. Okay, so if you are reviewing previous books, if you are reviewing previous material, just take what make the benefit here, but you must understand what is going on, not to be directed wrongly to the previous way of preparation. Okay, so that's why if you are solving some things or taking some resources from old exam scenario, just be aware that don't be deviated from the new criteria. Okay, and this is important for the colleagues who had the history with the old system. You know, maybe someone is taking the exam previously from 2 years, 3 years. Now the change will happen on him, so he have the experience of rapid reporting. Okay, and he have the experience of being good with X-ray. Okay, now you are good with the X-ray. in the level of rapid reporting. But in the level of short, no, you need to practice. You need to practice more and more because the cases will have multiple pathologies. It not the same. It was not the scenario before. It's more complex. You need to type a lot. You need to set a lot in the exam setting. So this is need to be you need to be prepared for it. Okay, but no worries. Most of the things in the background nearly the same. But how to present, how to make it to the point, this is a change. For new colleagues joining the exam, I think everything is in fact is new for you. So don't waste your time with the old stories. Okay, focus on the new stories in October and June, and what we are discussing. Follow the college page and read everything there yourself. Okay, and try to accommodate. Actively practice, because practice is the only way, no others. Practice is the only way to pass. I said this to all colleagues who joined October, and I received the call after it passed. You are right. Practice is the only way. That's it. Okay. I think we have a last one. Yeah, README platform. This I must tell it about it. You have free sample of short or long if you don't have previous access to our website, readmeradiology.com. We already established 18 short exams. Okay. I think we are going to review also these short exams to make it more tougher. Okay. Also, Dr. Saidi did a very nice job making a new course for the shorts, New Eagle Eye. This is recorded material. We make it mini short exams, 5 cases in each one, and Dr. Saidi make the answer in Arabic, and I think they bought also the sample answer last days. So you have the written answer and also a video discussing the tips and tricks and how to solve the shorts, because this I think we need to make more material for shorts, because I think this will be noisy in the coming days. For Viva, you need to practice in always, even in Triple M. We because the change in the exam, and before we have in 15 minutes we can show in the course with each colleague 5 cases. Now we are going to show 3 cases, so the number of cases come reduced. So we make a new one, we will add a new thing to Triple M with already existing activities. We are going to make buckets for Viva and ask colleagues to record these videos, this Viva buckets, and send them, and to choose randomly from them and evaluate them and send the feedback. This is actively will be from January. So I think also January Triple M, maybe we have 2 or 3 seats remaining. So this is very important. So all the ways, the importance of this new way is to ensure that you are practicing Viva alone in the home without colleagues, just to open the case and start recording and hear yourself. Record and hear yourself until you reach the very good answer, and send us this answer, and we are going to listen to it and revise it and send you a feedback about it. So this will add a very good experience to you. Okay, we are pushing colleagues. This is our way in RADME, pushing colleagues to practice, as we believe the practice is the only way to pass. Okay, ask our team for help. Ask me especially, like free calls. I think a lot of colleagues take these free calls. If you need a free call again, just arrange with the team. Group discussion, our Telegram channels, make it open discussion. Ask anything at any time. We are going to help you a lot. I want to share with you, in fact, to end before the end of this. I want this will go so long, but I think it's very important to see to take a sample one case of short and five, and I will show you by discussion how to think in the case and how to write it, and why they are searching in this case. Okay, we can open this in also chat if you want to discuss the findings or things. What do you think in the case? I can give you 1 minute to tell me, or write it write the main findings or the things in the chat. Okay, are you ready? Let's go. I will stop share this one until opening the cases. I'll start with the short one. Okay, the noisy one. Okay, want to share. Okay. Okay, you can see my screen, I think. You can see it? Yeah, great. Yeah, someone is writing the final answer. Yeah, yeah. Very, yeah, by the end, they will need the final answer, but they need you to write what is there. How to describe this one? Yeah, good. Yes. Okay. Yes. Nice. Okay. I can see, I can read it because for the recording. So multiple bonic cystosis, multiple projected away from the joint, point away from joint, multiple bony overgrowth, outgrowth. Yeah, this is very important. Yeah, L-mile flask, multiple bony outgrowths are seen at metaphysis of distal proximal tibia, away from the knee joint, no periosteal reaction, cortical destruction, or extraosseous soft tissue. Yeah, starting to be more to the point. Thank you, Lamson. Yeah, medullary cortical continuity. Yeah, cartilage cap need MRI. This is yeah. Anyone want to share more things? Skeletal survey. Yes, excellent, perfect. Yeah. Others? Anyone is going to tell? So here you started to make it and follow up of systematic. Yeah, all the time they are going to make it with when the patient is symptomatic. So I think no one is telling about fractures. What do you think? If there is any fractures or not in this case, the pathological fractures, a patient will have the pain when they have a fracture or malignant transformation. Yes, no fracture. Yes, this is very important. But this is important negative to tell because most of the time they are going to tell that the patient presented with pain. Once the patient presented with pain, you need to exclude all the negatives because sometimes you will be a worry about some area maybe hidden in the periphery of the film or something that may affect the destruction of the or the presence of soft tissue and soft tissue calcification, which will represent the feature of the features of the chondrosarcoma that will exist on the cartilaginous cap. So soft tissue swelling or soft tissue calcifications will be important negatives in the case. So this is very important also to mention. This is very important. You need to take it to the point. Skeletal survey is important, and if this is a first presentation for the patient, or if this is not the skeletal survey is reviewing previous imaging and reviewing any change in the behavior of any bone, okay, and the MRI will be in the recommended evaluation if the pain is not explained. Yeah, yeah, is not explained in the by the X-ray. Yeah, if you don't have the explanation why the patient is having pain, because pain may be due to compression from any this exostosis on a nerve. This may be a cause of pain. So MRI will be the important next step if there is no explanation. So we are making the X-ray in this case to ensure the presence of fracture or a sure sign of malignancy, okay, as a rapid review of in the acute setting, the patient presented with acute pain, okay. But if we don't have the answer, then MRI must be recommended as a part of the follow-up or the part of the management in this case. Agree? So, you know, if this is your last case in short reporting exam, after 2 hours of reporting, what do you expect from yourself? Are you going to remember all these things? This is a question. Okay? This is what I want to send to you as a final message. Yeah, totally exhausted. Half of this you are going to lose unless you practice a lot. Yeah, yeah. So you need to practice a lot. Practice is only way to be familiar with this level of exhaustion. If you want in the routine practice, if you are doing 10 cases, 20 cases per day in your shift, and this everything is cool, and you are shifted to a very bad location in our definition with a huge load, you are going to take time, maybe 1 month after the orientation about the system and the colleagues and all the system and how they doing everything, and you are going to struggle every day during the first months to move yourself from the 20 case log to the 50 case log. You got the idea? But by the end, you will be like AI. You will accommodate yourself. That's why I'm telling you here. Practice daily. Start with 5 cases, short, in 15 minutes. Then expand it to 10 cases in half hour. And then 15 cases in 1 hour. Then 25 cases in 2 hours. Until you are not lazy, you are not feeling boring. Type and write very quick. Check your spelling. Check your performance. Check the first case and the last case. The timing of each case. How many minutes you are taking for each case during the. This is very important. This is the exam is asking about knowledge. I know and everything, but if you know everything, and if you very good in radiology, but you didn't practice the exam style, you will be stuck. End of the text. Okay, let's go to Viva case. Let me take it from here. Yes, I will bring it. Yeah. I will scroll it. This patient presented totally unwell. Patient is unwell. Nice. Okay. Yes. Yeah. I will not tell the everything without yeah. Nice telling the findings. I will share the long window for colleagues who are asking the long window. Yeah. Which one will have the systemic review? You may missing something. What do you think? Hmm. Yeah. Okay. Check the bone. Okay. Good. Let's check the bone. This is a bone. Why you need to check the bone? This will be a question from the examiner. Okay. I will told you something. You picked all the findings, but you missed the safety in the film. What is this? Anyone know? Yeah, what happened? You all told me a moderate pericardial effusion. No one talked about pericardial tamponade. The patient is unwell. The reflux in azygos, the reflux in the IVC, the straightening of the cardiac border, and the compression of the right cardiac heart borders or chambers. This is with the pericardial effusion. No one is talking about pericardial tamponade criteria is going to lose the case getting 0, 0, 0, 0. All zeros. The patient is going to die maybe from this scenario if this is rapidly grossing. And this is all real findings, I know, but they are in the background of this one. It will be subtle. Agree? Let's go to the case again. Okay. So once you got any finding in any way, you just go with it until the end. So pericardial effusion, when you just tell pericardial effusion direct, this is a training. This is how to train to pass the exam. What is this? Is this finding can lead to emergency? Yes. So once you told pericardial effusion, the criteria of the emergency will come after it directly. There is pneumothorax. So this is moderate pneumothorax. That criteria of tension must come as a negative directly. There is no flattening. There is no mediastinal shift. There is brain edema. If there is mass shift or not, there is hemorrhage. If there is mass effect and a midline shift or not, this must come in the statement of describing the findings. And this is why the colleagues are coming from the exam coming outside and telling, I told all things in the film, I got the bad marks. You are missing such scenarios. which is the safety emergency, will lead to harm to the patient, will lead to insult. Okay, so they are not going to make, and they are not going to push you through this. You must be prepared. You are in the exam, so no one is going to give you all the help you need. Okay, because you are in exam, no no place to help. If you got help, okay, in the exam room, you are going to lose marks, and sometimes a lot of marks. Okay, so from here, it's about practicing, picking the findings, making it's about not about the final diagnosis only. It's about how you reach the final diagnosis, how you follow the how you understand the findings, why there is pericardial effusion. Is this pericardial effusion is a simple pericardial collection, or it can be due to aortic insult? Maybe. Anyone talked about the presence? Is it hyperdense or any pre-contrast study? No one talked about this one. You need not to tell pericardial effusion simply. You need to tell why there is pericardial effusion, and what is the effect of this pericardial, because this is not a subtle pericardial effusion. It's not a REM. It's moderate amount at least, and this is causing pericardial tamponade. Okay. This is to highlight the importance of the comprehensive. So if this is a minimal pericardial or mild pericardial effusion, not causing pericardial tamponade, and you told the examiner the criteria of pericardial tamponade, what you did, you showed that you know the topic of pericardial tamponade to the examiner, so you are going to be marked for the knowledge. You showed the examiner that you are a safe radiologist, having everything in the place. You are organized. You are safe radiologist. Have your mind is oriented to save the patient from any harm, to make the subtle findings that may lead to a problem. You may ask for follow-up. This pericardial effusion, is it growing up very well and very fast? This may affect the patient and giving him and affect his life. So you are going to make attention for this one. Okay. Oh, your patient is having some partial collapse on the right upper lobe. Yeah, great. Yes. What is the cause of a collapse? We don't know. We are going to examine this, and we will see this. But first, we need to finish this one, and then we'll come to this again. Okay. And this is all of these findings are making the patient unwell. Okay. At the end, but which one is more serious? I think the pericardial tamponade. So here you need to show the urgent management procedure, that you are urgently announce the clinical team about this finding. You are going to arrange urgently for echocardiogram in the setting of the to confirm the diagnosis. You are going to tell the colleagues about the finding. The patient may need to evacuate these collections from the lung and the pericardium as soon as possible to prevent acute cardiopulmonary issue. So final message to you all. FRCR to be is a challenge. It's not impossible mission. No, you can finish it. You can do it. Just you need to be focused. You know how to prepare. You do your best. Don't lie on luck. Okay, because this is don't. As I told in all the session, you need to be structured, focused, trained, and fixing as soon as possible all the defects. Okay, this is the only way, I think, to get this easily with the time. And I hope you enjoyed this session. Any questions? I will open the window now for any questions. Anyone to ask something, I'm here to answer. I will be glad. Which is better, to get knowledge first, then to try 5 cases daily practice, or to do both, getting knowledge and getting practice 5 cases at the same time? The best way, anyone, already take the free call from with me. I told him practice and let practice guide your performance. Practice, practice the five. I stuck. I can't remember the differential diagnosis. So open Chapman, open Wikipedia, open other. Yeah, what are the differential of this one? Yeah, so I will repeat the answer again. So you start to repeat the answer again and telling the yeah. Now good settle. Yo, but I can't put here the differential of this one because of so this studying pathway will let you be mature how to and with time you will be familiar with the cases, familiar with the ideas, familiar with the differentials. You will going to memorize everything. Your way of studying this way is going to affect your performance dramatically in few days. If you practice this daily for 10 days, maybe 20 days, you'll find yourself dramatically improved.
صحيح.
Hello? Anyone want to ask anything again? No lose hope. Once we are in the life, so hope is there. Uh, uh, we are here to learn. With the pen until to the grave. This is our mission in the life to learn until.
هو لسه القرآن موجود؟
Huh? Yeah, Dr. Hatem, you are asking something? Hello, Dr. Hatem? Yeah, I think he is asking something. Okay, I don't want to make this very long for our colleagues. Thank you for all for attending and being with us. I hope this is good benefit. Yeah, Ali, you have a question. Some of the October get zero in short. Total zero in short. I'm sorry, I didn't get your get zero in short. I think there is no. Yeah. In zero in Viva and zero in. I think in long cases because short cases, I don't think they gave the final result. Each case in longs they give each case how mark you get it inside in each case, but zero in shorts I don't think, and it can be. Why? If you missed the main finding in the film, uh, uh, it can be. I think. With a comprehensive list of likely topics to practice FRCR to be. I think for my advice, I take this advice, use survival guide index, the book of the great John Curtis. But this book is a very old one. It's more than 20 years ago. So you just take the list, the index of the topics, and print it and make it in front of you. All these topics are very common in the exam settings. But the idea, the way they can go through it, it will be different from the previous scenarios. New ideas, I mean, new presentation of the case, maybe new modalities like this one. Yeah, communication skills, I think this is a weapon of two ends. Yeah, it can be. Yeah, sometimes when you are practicing badly in one case or giving me a very bad impression that you are not a safe radiologist, I will use this to prevent you from passing the exam. And I think this is one of the explanation why one colleague is getting. Yeah, this is in their hands. Yeah, I think, and I think this is. I think if you are not doing very good in the other room, you may lose the chance in this room, and this is explaining the previous scenario. This is the same issue before. I think if you are not doing safe practice in the exam, previously also you lose the whole room. You got four in the room, four from eight before in the before previous scoring. I think the same applies here. But if we are going to make a comprehensive, or if we are going to go to the scale how they grade this one, it depends on your way of talking. Okay, your speaking, is it clear or not? It's not about how native you are. No, it's how, are you clear? Are you getting the message clear to them or not? You give the message clear. That's why most of the time I am telling overseas colleagues to use I can see, I can't see. Don't use the connective words and statements. This is make noise, and sometimes they are not understanding what you are saying. Being with a stress, your voice tone becomes very low. So ensure that all the time that your voice is high, is confident. Mask your stress, mask your fear. Okay, be yourself. Really, being yourself and practicing as yourself without fear, um, uh, without. One of our, I will let you know, one of our colleagues, he told me that he was obsessed inside one of the rooms by the facial expression of the examiners. Okay, so he is very nice colleague, and he is very clever. And I was very worried about he didn't pass the exam because of Viva, because this make him very nervous inside the exam, and then he got he changed sometimes his answers because the facial expressions of the examiners. Okay, uh, unfortunately, I was very afraid that he may not pass this room with this behavior, because this is this is this is very bad. Okay, so we need to practice this one confident way, very clear, interactive. If they ask you something, don't interrupt them. If they interrupt you, just show yourself that you are going to take this from the end. Make it interactive. If there is a communication or discussion, try to make eye contact if this applicable through the, and not interfering with seeing the images, so on. Yeah, like this one, because this is very important, and practicing this will allow you to get these marks easily. Okay. I enjoyed being with you. I hope this was helpful, and I hope everyone is going to hear this one too, or listen to this lecture. It will be of help. Have a good day, and we are going to celebrate all of us about the passing, inshallah. So don't worry. Um, Practice hard and do your job, and everything will be okay. Have a good day. Assalamu alaikum.